Thank you. Thank you so much. My name is Dr. Carolyn Missouri. I am the chair of the White House Initiative on Women's Health Research. And I want to tell you just a thing or two about the initiative, please. The initiative is led by First Lady Jill Biden and the White House Gender Policy Council, which is headed by Director Jennifer Klein, who's sitting across the table from me. And the initiative is focused on fundamentally changing the way in which we fund and approach women's health research. I want to thank the University of Illinois at Chicago, and especially Dr. Pauline Maki, who's been a long-term colleague, and her research team, including Alexandra Paget-Blanc, Alexandra, and Rachel Schroeder, Rachel, for hosting us today and providing an opportunity to see their work on a very important topic of menopause. Congressman Lauren Underwood and Congresswoman Robin Kelly, your partnership on this issue in Washington is invaluable. Thank you for working every day to help women here and around the country. President Tony Preckwinkle, the women of Cook County are fortunate to have you representing their interests. We're also thrilled to be joined by Ms. Halle Berry, who you will hear from in a few moments. In recent years, progress has been made in understanding conditions that are uniquely experienced by women, as well as those experienced differently by women and men. Yet, there is much more research to do. That's why President Biden launched this initiative last November, November 13th. As part of the initiative, he directed federal agencies to provide concrete actions that they will take to increase research on the health of women. We are also working with stakeholders to explore new public-private relationships, partnerships, and find areas where additional investments in research on the health of women will be transformative. It is now my honor to turn to the First Lady for comments. Dr. Biden.
Oh, thank you, Carolyn. And thank you to the press for being here, because really you're going to be the ones who inform the general public. So I appreciate that you came here today. So good afternoon, everybody.
Good afternoon.
So if you ask any woman in America about her health care, she likely has a story to tell. And yes, you know her. She's the woman who gets debilitating migraines, but doesn't know why, and can't find treatments, options that work for her. She's the woman going through menopause, who visits with her doctor and leaves with more questions than answers, even though half this country will go through menopause at some point in their lives. She's the woman who dies because her heart disease isn't recognized, since her symptoms don't look like a man's symptoms and a man's heart attack. Women are more likely to die after a heart attack, even though men and women have them at similar rates. This has to stop. And my husband, President Biden, is doing something about it. Women in this country live longer than men. But what are those years like? Can you pick up your grandchildren without any pain? Can you walk around the block without feeling tired? These women live with chronic diseases that we don't know enough about and that we don't have effective treatment options. Last year, Maria Shriver came to me about this issue, and it resonated. And when I talked to Joe, he took action. And that's what he does. He learns about a problem, and then he goes to work tackling it. He doesn't waste any time. So in November, we launched the White House Initiative on Women's Health Research. Halle and I are here today because the University of Illinois Chicago is doing groundbreaking research on menopause. Every woman will be affected by menopause, yet there's a stunning lack of information about how to manage and treat its symptoms. UIC is working to change that, and I'm grateful to Pauline for hosting us. The White House Initiative on Women's Health Research will make sure that women are not just an afterthought, but a first thought. We will build a future where women leave doctors' offices with more answers than questions, where medicine meets the needs of everyone, where no woman or girl has to hear, "It's all in your head," or "It's all just stress." Together, we're going to make that future a reality. So now it's my pleasure to introduce someone I'm grateful to have joining us today. She's a powerful advocate for women's health. She's been a leading voice in raising awareness about menopause, and she's helping us to build a brighter, healthier future for women. Please help me welcome Halle Berry. Halle?
Thank you very much. I am so honored to be here at the University of Chicago, Illinois, and thank you, Dr. Biden. You are a beautiful First Lady.
Oh, God.
And thank you.
Oh, look at what, really?
You are an exquisite First Lady, and thank you very much for allowing me and inviting me to be a part of this journey. Thank you very much.
Thanks.
So the first thing I would like to share is, because I get asked this question all the time, what brought me to this critical and very important work? And I think I am no different than any other woman right now who reaches their menopausal years or perimenopausal years, and they felt like, what the heck is happening to me? I had no idea. My ego said to me, I'm just going to miss the whole thing. I'm going to skip it, because I thought that I had cured myself of type 2 diabetes. Well, I didn't cure myself, but I got myself off of insulin. I got off oral medication with my diet and exercise. So I thought, I'm going to eat well and exercise. I'm going to have a great mindset, and I'm going to skip this menopause thing. It's not going to happen to me. All of a sudden, one day, guess what? It got me. And it got me bad. I go to my doctor and I tell him, "It's got me bad, doc. Help me." And to his credit, he was a wonderful doctor, and he said, "Well, you can take hormones, and here's what you do, and then it'll pass." Well, that didn't feel like that was good enough for me. And I felt like, if that's not good enough for me, and I have access to some of the best doctors in the world, how could this be good enough for every other woman? So that's exactly what got me on my journey. And one of the most staggering things I learned when I got on my journey was that as a menopausal woman, we lose $1.8 billion in the GDP is lost every year. And that's just an estimate. I've been learning that it's actually much more than that. And I also learned that the NIH Office of Women's Research they only receive a little over $76 million. Like, that seems like a lot to many, but that's small in the bucket of women's research. So I'm passionate about putting hard numbers behind what we are given to help, women and research in the area. I think money needs to be raised and allocated so that doctors can be retooled, so that we can have more experts, right? So that every woman has an opportunity to get quality premium care and not just told you have to just white knuckle it. It will eventually pass. That's just not good enough. That's not good enough. 50% of the population are women and are suffering, and it's just no longer good enough. We no longer should take the back seat, right? So that's what wakes me up every day now. I have a forum that I've started, an online presence called Respin. I'm retooling that and respinning what Respin is all about, and it's going to be solely dedicated to women down this path of life who are in their perimenopausal years or menopausal years, because I desperately want to create an environment, a forum, a platform that I wished I'd had, right? I feel like I'm on the tail end of it now, but I wish I had had all the information that I hope to be able to bring to the public. So thank you very much to have me here at the hospital. I know I'm going to learn more. I know I will add, a wealth of information and take that back to my group and my organization. So thank you. Thank you very much for having me.
Thank you.
Thank you. Dr. Maki, Dr. Pauline Maki, I'd like to ask you a question. Why is it important to support more research on menopause?
Well, thank you, Dr. Missouri. And welcome, Dr. Biden. Welcome, Halle, distinguished guests, to the University of Illinois at Chicago and our health enterprise, UI Health. We are so grateful to you for spearheading this one-of-a-kind initiative that's going to be a game changer for women's health. I've been in this field of menopause research since I was Alexandra and Rachel's age, so almost 25 years. And I'm telling you that we have such excitement in the field about what you're doing, and we feel such promise. Think about this. This initiative will transform women's health research, and what that means is that we will transform women's lives, right? So, Halle, thank you for lending your powerful and incredibly well-informed, I might add, voice about menopause so that we can raise the awareness we need and destigmatize it as it should be destigmatized. Menopause is having a moment. It's having a big moment. We're seeing Super Bowl ads about hot flashes. What on earth is going on here? Well, what's going on here is women are demanding that we do better. In 2023, the New York Times had a cover page article in its magazine, "Women Are Being Misled About Menopause." And it described the challenges that women have in their journey navigating the health system. Is this a menopause symptom? Am I just aging? What do I do about this? And how come I can't find a provider? It was the #1 shared article of the New York Times in 2023. Women are demanding that we do better. So half of the population goes through this. Shouldn't we have a firm scientific understanding of what happens to women's bodies, what happens to their brains? Because without that, we can't give women the personalized care that they need. Now, why is it that we know so little about menopause? As my dear friend and collaborator, Dr. Rebecca Thurston, said in that New York Times article, we seem to have a very high cultural tolerance for women's suffering. Not all women suffer through menopause. We don't want to pathologize it. Some women sail right through. But some women do have very negative experiences. And those experiences continue long, long after they've transitioned through the menopause. So we here at the University of Illinois and UI Health have a very long-standing history of doing community-engaged research on women's health. It's one of the things that we're most known for. And we do this through a diverse lens because who we serve are marginalized women in the south side of Chicago and in the state of Illinois. And so that's what we do in our research as well. We do it through a diverse lens. And I'm not saying this just because they're in the front row. I'm saying this with complete authenticity. I'm able to do the work that I've been doing here for the past 20 years because I have support all the way to the top. So Chancellor Miranda, thank you. Provost Colley, thank you. Vice Chancellor for Health Affairs, Bob Barish, thank you so much. And in absentia, Dean Rosenblatt. Without their help, we couldn't do this work, but it is who we are. We live and breathe diversity in our research. So what do I do? Why am I here? So the work that we do focuses on menopause in the brain. What happens to women as they transition through menopause? What happens to their cognitive abilities? What happens to their mood? And how come some women sail through menopause just fine, and then other women can actually be debilitated by it? What's the biology of this? What role does estrogen play? What role do hormones play? Because without that knowledge, we're not going to be able to personalize care for women, right? So we need that. And that's why we need this infusion of research dollars for women's health. We need to get women the help that they need. For brain health, it's critically important that we know this. Even if you're not a fan of women's health research, and you should be, Alzheimer's disease is a public health crisis. We have no cure for this. So the goal is what? Prevention, right? So how do we prevent it? We bring midlife adults into their later years with the very healthiest brain that they can, so that if and when the pathology of Alzheimer's disease strikes, that brain is resilient to that pathology. It's going to cost trillions and trillions and trillions of dollars to care for Alzheimer's patients. So this is just smart. And so with great increases in funding for women's health research, with unparalleled leadership from our president and the White House, we can finally get...
Thank you very much, Pauline. Appreciate it. I'd like to turn to our congresswomen now, and first start with Congresswoman Underwood, and I was wondering if you had comments.
Well, thank you, Dr. Missouri, and good afternoon, everybody.
Good afternoon.
Dr. Biden, thank you so much for your groundbreaking initiative and your leadership on this issue. And Halle Berry, thank you for being such a strong champion for women's health. Dr. Maki, thank you for hosting us here at UIC. This is so exciting to be with you today. As some of you may know, I began my career working to implement the Affordable Care Act. And I am so delighted to be here in partnership with the Biden-Harris administration, continuing our fight to make high-quality, affordable health care available for everyone across our country. Just yesterday, the administration announced that 20 million people signed up for health care coverage with the Affordable Care Act marketplace plans. And the open enrollment deadline is next week, January 16th. And so just have to make sure people know that there's still time to get covered. And it's so important that families have this health care coverage, especially women, as we navigate the unique biological changes that are possible within our bodies. And it's so critical that we have high quality health care so that we can get the services that we need. Right now in our country, we are facing a growing maternal health crisis. Moms in America are dying at an unacceptable rate, and it's higher than any other developed nation around the world, and it's getting worse. That's why in Congress, we wrote the Omnibus Act to solve this crisis, and we are fighting to get it signed into law. Women and our needs have been under-researched, they've been underrepresented, and they have been under-resourced. And, quite frankly, it feels like our needs have been ignored in healthcare for about as long as modern medicine has existed. The White House Initiative on Women's Health Research will help us close these gaps. So today, we're so excited to be here to see these innovative researchers like Dr. Maki and her team who are doing this great work, focusing on preventive care and treatments that can be targeted to address the individual needs in menopause. It's an exciting step towards improving the quality of life for women, and I'm so looking forward to learning more about the many innovative ways that we can work together. Thanks again for having me.
Thank you very much, Congresswoman Underwood. Thank you. Now we turn to Congresswoman Robin Kelly. We welcome your remarks.
Good afternoon, everyone. Great to see all of you. I, too, want to thank Dr. Joe Biden so much for your work, and President Biden. It's so very important. And Halle, it's so great to see you again. You lit a fire under us when you came to Washington, D.C., and you just spoke the truth. And it was so interesting to hear all of my colleagues say the things they say. I was laughing that some said when they were going through menopause, they wanted to kill their husbands. So it benefits the men, too. Whatever research that we can uncover. Thank you, Dr. Maki, Dr. Missouri, and to the interns or PhD students for all of your work, and great to be here with my colleague, Lauren Underwood. I'm on the Healthcare Subcommittee. I'm the chair of the Congressional Black Caucus Health Brain Trust, co-chair and co-founder of the Caucus on Black Women and Girls, and just became, it's a bipartisan committee on maternal health. So I do a lot of work around women's health, and I've learned so much myself coming to Congress and what the needs are. But actually, I will say more, I'm more shocked at what we haven't done for women and how women have been ignored and the stories that we hear. But luckily, people are listening. And in the meeting we had with you, it was bipartisan listening, which is a great thing in Congress. And there are pieces of legislation now that deal with fibroids and deal with menopause. So we're hoping that we're moving forward. I know my daughter would kill me for saying this. Hopefully she won't hear it. But she didn't even realize she had fibroids, and she had surgery, and they thought she had a few, and they took out one as big as a bowling ball. And then a few others. She's fine, thank God, but it is an issue, but something she never even entered her mind. So we have to make sure we're advocating and educating and supporting our medical folks and researchers as much as possible. And you definitely have an ally in me. So thank you so much.
Thank you very much. We want to turn to the students next and talk with them just a bit. And I would like to start with Alexandra Paget-Blanc. And I wonder if you would be kind enough to speak with us a bit about what in your graduate school career led you to follow the path of menopause research.
Sure. Hi. Good afternoon, everyone.
Good afternoon.
This is a very incredible opportunity to be here and talk about my research. I'm Alexandra Paget-Blanc. I am a doctoral candidate in the graduate program in neuroscience here at UIC. I work in Dr. Maki's lab, and I conduct clinical research to understand the link between menopause symptoms and memory performance, specifically in Black and Latina midlife women. So I came to UIC with experience in studying sleep, and I wanted to apply my training to women's health, specifically cognitive health in midlife women. So my work really builds on two important discovery in menopause by Dr. Maki. First, she showed that hot flashes associated with memory problems and brain dysfunction in menopause women. This is a very important finding because it really raises the question whether treating hot flashes could help women optimize their brain and cognitive health as they enter and go through menopause. Second, Dr. Maki showed that marginalized Black and Hispanic women experience more severe and more persistent memory problems than any other group. So I wanted to bring those findings together in a study to understand how hot flashes could affect cognitive function in Black and Hispanic women. We know that Black women, on average, experience hot flashes for about 10 years, and for Hispanic women, they experience them for 8.6 years, which is both longer than any other group of women. And they typically do not get treated for hot flashes. The second part of my work is also that I wanted to apply my training in sleep into this line of research, because we know that Black and Hispanic women show more sleep problems during menopause than other group of women. So we know that poor sleep means poor memory, poor brain health, and in general population, it's also associated with increased risk for Alzheimer's disease and dementia. And many people are not aware that Black and Hispanic women are also at an increased risk for Alzheimer's disease and dementia. So essentially, ultimately, for my work, what I wanted to do is merge all of these questions together to try to understand whether untreated hot flashes, sleep problems, are associated with worse cognitive function and cognitive impairment in Black and Hispanic midlife women.
A bright future going on. I'd like to ask you the same question, Rachel.
Thank you, Dr. Missouri. So I'm Rachel Schrader. I'm a PhD candidate in the UIC graduate program in psychology, and I've been working with Dr. Maki for several years now, continuing to grow our understanding of the role of estrogens in memory and brain function. And I came to UIC after training in the use of cutting-edge, high-resolution brain imaging techniques. And during that time, I also really grew in my personal interests in women's health. So I was drawn to Dr. Maki's work with Susan Resnick, where they had first discovered where estrogen binds in women's brains. And that work and the limited subsequent work in that area inspired my desire to investigate how estrogens in women may impact women's brain health. So where Dr. Maki's previous work had focused on how estrogens affect specific regions of the brain, I wanted to look at how estrogens may influence brain regions in concert and how, with networks working together to support memory function. So my graduate research so far has shown that even the low levels of estrogens experienced in postmenopausal women can affect these memory networks in the brain. And what we really need is more research dollars to understand how we can use this knowledge to develop interventions that will help women maintain their memory functioning as they transition through the menopause.
You are right. Thank you for that. And finally, I'd like to turn to President Preckwinkle, and if you would be willing to say 2 minutes for us.
Yes, I promised that I wouldn't talk more than 2 minutes. So. First of all, I'd like to thank you, Dr. Biden, for coming to visit us again. We're very grateful for your presence and for the attention that you brought to this issue. I want to thank our medical folks who are here. Thank you all. We're very grateful for the good work you're doing. And of course, Halle Berry, we're grateful for the attention that you've brought to this issue. I want to focus on the two congresspeople who are here. They've done a lot of work on women's health that some of you may not be aware of. First of all, on maternal health and the terrible racial disparities in this country around maternal health. And I'm just grateful to both of them, Congresswoman Kelly and Congresswoman Underwood, for your good work. And this of course, focus on menopause is just part of their larger concerns for women's health. So thank you both. We're grateful to you. I want to acknowledge Senator Collins, who's here. Are there any other elected officials here, Senator? Okay, she's a state legislator in our Senate, and this is her district. And so she's here today on behalf of her colleagues in the state legislature. We're very grateful to see you, Senator Collins. Thank you so much. So I'm a history teacher by profession, and I think it's important to acknowledge that historically in this country, medical research has focused on men, and furthermore, white men. And so there hasn't been as much attention as there should be to women's health issues and to the issues that concern people of color. And these terrible inequities and disparities are things that we need to address collectively. I'm very grateful to Dr. Biden and to Joe Biden for bringing attention to this issue around menopause, but we've got a larger challenge around gender disparities broadly and racial disparities broadly, which I hope will continue to be lifted up, and I know they'll be lifted up by Congresswoman Kelly and Congresswoman Underwood in Washington, and I hope the rest of us will take on that challenge as well. I'm encouraged to see the Chancellor here, Chancellor Miranda, and Dr. Barish, who's a colleague of mine in the Boy Scouts. So,
You were a Boy Scout?
the Pathways to Adventure Council, which is one of the Boy Scout councils in our region, and he and I share service on that board. So,
I bet. Well, I
all
want
right, thank you.
I
I
wanna-
made it in 2 minutes. So
You
give me
did,
credit.
you did, and you did a wonderful job, and I thank you for that. And I thank everyone who commented here today, and I think it's a perfect note to end on. At this point, we're going to conclude the roundtable, and we're going to have the pleasure of Dr. Maki taking us on a tour to see some of her research on menopause. Thank you all very much, and thank you for your interest in the health of women.